Hello, my name is Dr. Shargani of Rheumatology, a rheumatologist based here in Long Island, New York. Today I'm going to explain what a positive ANA test is. A positive ANA test stands for antinuclear antibody test, and it's typically checked as a screening test for rheumatologic or autoimmune disease. This blood test is usually checked by a primary care doctor or another specialist at an attempt to see if there's any kind of sign that someone may have an autoimmune or rheumatologic condition. The blood test itself, the antinuclear antibody, basically looks for antibodies in the blood that are focused at targeting the structure inside of the nucleus. So that's where the name antinuclear antibody comes from. Traditionally, this test has been used as a screening test for lupus, but more widely now used for checking for other rheumatologic or autoimmune conditions. 20 to 30% of patients can have a positive ANA and they don't ever develop any kind of autoimmune or rheumatologic condition. So when patients get sent to a rheumatologist or myself, we always ask, well, the first question we ask is, why was the ANA checked? Because the most important thing is what the patient's symptoms are. So we look for what we call constitutional symptoms, like fevers, chills, unintentional weight loss, rashes, joint pain or joint swelling, any color change to the fingers, like red, blue, purple, which is called Raynaud's. We look for hair loss, sores in the mouth, ulcers or sores in the nose, fatigue. We look for a lot of symptoms that could be seen in autoimmune or rheumatologic conditions, because the point of this video is that the ANA itself is not very specific. ANA is a non-specific screening tool, but we look for more specific antibodies in the blood work. So once we hear your symptoms, if we think it sounds more like lupus or Sjogren's or mixed connective tissue disease or vasculitis, then we check more specific blood work to see if you have those kind of antibodies in your blood. But if the patient does not really have any clinical symptoms, then a positive ANA alone does not really mean anything clinically. So this is pretty much what an ANA test means. If you do test positive for an ANA, the first thing to ask yourself is if your symptoms do fit any of the ones I kind of described. And, it doesn't hurt to get checked out by a rheumatologist to see if you do have signs of an autoimmune or rheumatologic condition. If you are looking for a rheumatologist in New York, you could definitely check us out here at Manhasset Rheumatology. The link is below. And if you have any other questions about a positive ANA or what it means, leave a comment below and I'll try to help out. Thank you guys for watching the video.